Well, good afternoon. I'm here with Commissioner George Perez, Banking, and Bruce Adams from the Credit Union League, and Don Margolis from the Banking Association. And we have some announcements to make regarding banks in just a couple of minutes. Just give you a brief update sort of on where we are right now. We added another 557 people tested positive for COVID. 16 fatalities, 608 hospitalized. So those numbers continue to ramp up in a way that we had anticipated, sadly. Again, most of the folks who were found infected, 400 in Fairfield County, another 145 in New Haven County. So you can see that the virus is heading north. Hartford County right behind. But fortunately, as you know from yesterday when we had the hospital leaders here, we have capacity and we are preparing for that and doing everything we can to expand capacity going forward. One thing I was reminded of today, and I try and remind the White House every day, is that Connecticut is the fourth most COVID-infected state in the country per capita, behind New York, New Jersey, Louisiana, and Connecticut. And that's why I always impress upon the feds in any way I can, think about this virus as a region, not state by state. A little disturbing today to find out that the National Strategic Stockpile is now empty. We did get 50 ventilators, for which I'm very thankful, but for now we are on our own, and for now we are working our heart out, scouring the globe for PPE as best we can. And I got to tell you, as your governor, this breaks my heart. We've got doctors, nurses, bus drivers, cops, firemen, baggers at the grocery store and food bank, court marshals, juvenile detention facility, a lot of our frontline heroes. I'm asking everybody else to stay at home. These are the folks who are what we call essential workers, frontline, every day, going to work. And I feel like a general sending our troops into battle without the protective gear that they deserve. They don't have the defenses, and they're doing everything they can to save you. And I am working on that every day with my heart. We talk a lot about all the rules and regulations and orders that we can implement to make sure that those of you who are not essential workers stay at home, stay at home, stay at home. Maybe put a picture of one of those nurses or other first responders on your door, just as you think about him or her as you're about to leave. Think about the fact that you're not just endangering yourself, but you're endangering her and your greater community. I can't tell you how urgent this is as we head into April, which will be the horrible month. I'll tell you a little bit about some other industries we've got that are operating in different ways. Manufacturing, we've had good conversations with the manufacturers. Most of them are still open. You may be saying, why are they still open? Well, almost all of them are related in the healthcare or defense-related aerospace industries. Those aerospace defense are protected as critical industries, but we're working very closely with them and all the other smaller manufacturers that are in their supply chain, and trying to make sure that they follow the best practices. Everybody going into that factory floor, take your temperature, get fever tested, on the way in. Make sure that everybody that doesn't have to be there isn't there on the factory floor, so at least they can have good social distancing. Make sure that between shifts, and this is what the other manufacturers are doing, there's no overlap. And there's maybe an hour between shifts so you can really do the cleanup and antiseptics that you have to do. And frankly, at lunch, most people have closed down their cafeterias and people are going out to their car for lunch. These are the type of smart things that our manufacturers are doing, especially since they are still in operation by law, and we're doing everything we can to keep them safe. Transportation, I can tell you that not only is Metro North 95% less occupied, which is really good. I hope that the only people there are essential workers like those first responders. The airports are 95% without passengers now. Cargo traffic continues to go up. I was sort of struck talking to our Department of Transportation today, and which is striking to me. We still continue to do some of our major transportation projects, some of which we're in process already. We spent a lot of time talking about transportation this year. It was interesting to me that now, with 30-40% less traffic on most of those roads, we can close a lane or two. And what that means is we can do the construction faster at a lot less cost. So where possible, we're continuing to do those major construction projects, again, making sure that there's proper social distancing and only people who have to be there, actually are there. I'll tell you that as we think about our first responders and everything we can do to make their lives easier, we had our unified command call again today, and I was just struck by the fact that the 211 call, that's the call people can call anytime they have questions. Increasingly, the number of questions related to daycare more than doubled in the last few days. And Beth Bye, our amazing Commissioner of Early Childhood, is now working with more daycare providers, and many are considering reopening again. And we're opening the funnel for who has access to daycare, opening the funnel in terms of who is a necessary first responder that we actually have to get there. Obviously, at the beginning, it was nurses and doctors, and we co-located next to those hospitals. And now it's folks in nursing home, it's police, fire, corrections officers. We desperately need people safe and able to go in and be responsible there. Food. We continue to have, incredible food insecurity issues. Salvation Army is setting up a variety of additional local sites, and we do need more volunteers, folks who can help deliver, folks who can help package, folks who can drop that lunch out at some senior's home who we definitely do not want going out for lunch, but to have that delivered. When it comes to the homeless and nursing homes and corrections, all those places where people do tend to be in close proximity, we're doing everything we can to decongest, get anybody who is COVID infected or even suspected of COVID. We got them self-quarantined. We have them in separate quarters. And that's just incredibly important to make sure that we don't have these congested areas become a petri dish. And yes, for the folks in corrections, we continue to release those who are the most nonviolent, and a special focus on those who are older, those who are most at risk, trying to find out where they would be most safe. If there's a place outside of the corrections facility, or is it a separate negative air place that they can be safest going forward. I'll just say that from the health insurance folks, we've had a very good feedback from them. We're going to be able to make some announcements. You'll be able to tell you very soon. But I have a high degree of confidence that anybody who has been distressed by COVID in any way, shape, or form, I know this is March 31st. I know this is a date of some anxiety because bills are due, and I have it on very good confidence that your health insurance and all other insurance will go forward with a grace period, assuming that this is a COVID-related delay that maybe you have here. And, with that, I'm going to tell you just briefly and introduce George Perez, our amazing Commissioner of Banking. Our banks have been just extraordinary partners for us during this incredibly complicated time. And obviously, people have mortgages, people are worried about evictions, people are worried about foreclosures. And I think George has some good news on how we're going to handle that.
Thank you, Governor. Early on in this situation, the governor made it clear to us that he wanted us to reach out to our respective industry and figure out ways how we could lessen the impact on our citizens. So I've been working with Bruce Adam, who's the president of the Connecticut Credit Union League, and Tom Mangillo, who's the president of the Connecticut Bankers Association. And they both represent their industries, and we come up with a proposal, an initiative. And I want to thank both of them, because without their help this Saturday and Sunday, and before then and today, we would not be here today. And I'm happy to announce that we have an initiative that 62 financial institutions, credit unions, and banks have signed on to it. And we expect within another day or so, we'll have quite a few others that are going to join us. And they have not, only simply because we have not been able to connect with them, or there's still some questions that need to be answered, especially for the smaller size institutions. But I'm happy to announce that, you want me to go with some of the details, or you will do that? That as a result of this initiative, there will be a 90-day grace period for all mortgage payments that are related to COVID-19. So if you have a mortgage and you were a barbershop worker, restaurant worker, any worker, and you were laid off or furloughed, or your income has changed, you're to call your financial institution or your mortgage servicer and let them know that you have been impacted by COVID-19, and they will work with you to at least give you up to a 90-day grace period for now. There's also a commitment that for the next 60 days, there will be no foreclosures as a result of COVID-19. Again, all they will ask you is to attest that that's the case. They're not going to ask you for a doctor's note. They're not going to make you go through a lot of loops. All these institutions have also committed to making it an easy process. So most likely, the way it will be done is you go to their website. There will be several questions asked. You submit the form, and then someone will contact you. I will ask consumers who are hearing this, please don't, in the next minute, start calling those banks. They're not ready for those calls yet. Give us a day or two to be able to trickle down the instructions and the directions that those call centers are going to need to be able to service you quickly and with as minimum frustration as possible. What I want to assure you is that every one of those banks and credit unions are committed to help you and to work with you if you're a residential mortgage holder, as well as if you are a commercial customer. In addition to what I already stated, they will work with you in waiving fees related to late payments for mortgages, early CD withdrawals, and other fees associated as an impact of COVID-19. Last but not least, and there are other parts to this announcement, there will be no credit score changes for accessing relief. In other words, your credit score would not be impacted because you were given a 30-day, 60-day, 90-day, or in some cases, if it was warranted, something different. They would not report that as bad credit. They would not report that as a non-payment.
Thank you, George. Tom, thank you. What you're doing and everybody you represent.
Well, thank you, Governor, and thank you, Commissioner. And I'd just like to say that this is another example of a public-private partnership, if you will, with the business community that your administration has reached out to the third time, if I remember correctly. So it obviously does work. So our banks are obviously deeply concerned about our customers and essentially reaching out to them, which they have already done, and also having their customers that may be impacted by COVID-19 reaching out back to their banks, whether it be their branch managers, whether it be their commercial lending representative, so that they know exactly what's going on with their situation. The goal is to essentially do an early triage, if you will, as George was talking about before. Don't wait. Essentially go right in and contact your institution, especially when this program is up and running in a couple of days.
Bruce?
Thank you, Governor. These past couple of days has been an amazing amount of collaboration, and, I think our industry is built on collaboration. I think back to, FDR signed the Federal Credit Union Act in 1934 to pull people out of hard times, and that's really our purpose. In some ways, we feel like we've been training for this our whole lives, and for the past couple of weeks now, or few weeks, we've been modifying and doing all sorts of creative options for our borrowers, mortgages, non-mortgage loans, and we're really grateful for the opportunity to come together under your leadership and really give some good service to the residents of Connecticut. An old slogan for credit unions is not for profit, not for charity, but for service. And we're here to do that today. Thanks.
If I can say one more thing. Yeah. I want to emphasize that this is not government heavy-handed. The governor was clear he wanted relief for the consumers, but his preference was to do it in a collaborative way. And that's what we're talking about today. And I also want to assure all the consumers that your deposits are safe. If you have your deposits in a federally insured bank, well, not federally insured bank, but it's insured by the FDIC in case of a bank, or the NCUA in case of a credit union, they're safe. I would like to encourage you to be careful with a lot of different scams that are going out there, people trying to take your money, whether it is because of the $1,200 we're supposed to be getting, or because they're trying to get you to buy gold. If you want to buy gold, it's because you think it's a good investment, not because the world's coming to an end. So I just want to encourage consumers to be careful during this time, because we've got a lot of complaints about scams.
I'll just follow up. I know the note of desperation we hear, talking to many people, all the calls we get, and we've talked a lot about what we're doing in terms of health care, and I just wanted to give people a little bit more confidence that you've got, government's got your back, the banks are doing everything we can, no foreclosures, to be able to help you get through this. What we're trying to do with the health insurance companies, we get through this federal bridge which comes in, that covers interest payments, mortgage payments, and health insurance payments. So doing everything we can to give you confidence that even though you don't know what tomorrow will bring, at least you know that we've got your back going forward, at least for the next 4 months when hopefully we'll be on the backside of this crisis. Any questions?
On the level of verification, you were mentioning, Commissioner, the level of verification, if you are actually a worker, you're a restaurant worker, whatever. In other words, maybe you got your mortgage 3 years ago, you switched jobs, you don't necessarily tell that to your bank. What is the level of verification? I call up, I say I'm a restaurant worker. Is it pretty simple and I'm going to get it, or how does that work?
It is my understanding we're going to mimic the CARE Act, which is we're going to ask you to attest that you've been impacted by COVID-19, meaning you were laid off and so forth. If there's a reason to doubt you or to think there's fraud, then they will ask for additional information. But we're not, we're in a crisis, and we're not thinking people are going to simply try and call me naive, I guess, but it's way too many people, too much work, so we're going to try to facilitate it for everybody.
All right, so it sounds like it's going to be easy, but I'm just asking how easy this is supposed to be.
It's, you know what, there's an old saying that devil's in the details, right? And since we've never been here before, we've never done something like this, some of those details are still being worked out. But what I can tell you, the goal is to make it as simple as possible. So it is the discussion we have had with several of the bankers and the two leaders of the association is we're going to ask people to attest to it. And unless we have reasons otherwise.
Governor, you said 16 new fatalities. Is that within a 24-hour span? Is that like a catch-up over a couple of days?
You want to talk about the change of methodology, Josh?
Sure. So the 16 is in the last 24 hours. We're actually including an additional 17 reported deaths in the total, which are catch-ups over the last 2 weeks of deaths that were reported to the Office of the Chief Medical Examiner that had not been captured by our Department of Public Health. So as we've gone through this, we've been constantly looking for ways to get the most up-to-date information. And so there's a additional 17. So the total we'll report today is 69, actually. But there are 16 deaths that actually occurred in the last 24 hours.
So total 69.
Correct.
Okay.
That we'll report. And again, that's 16 that occurred in the last 24 hours, and then 17 that are essentially catch-ups over the last 2 weeks that had not been reported to DPH.
And how many total were tested positive?
3128.
And then how many people have been tested? Are we still running behind on testing?
We're up to 15,600 tests.
We did 1,000 yesterday.
So the medical examiner, these were autopsies? How is he confirming them?
They're being reported into the Office of the Chief Medical Examiner.
Hospitals are reporting to the medical examiner. Governor, I'm sure you must watch Governor Cuomo. He was talking about a peak within 7 to 21 days. Is that about right for us or not at this point? He's talking about 5 different algorithms that they're looking at, and that's why he's got.
We're looking at the same algorithms. We see that same chart that goes up and down. We see how you can flatten it out. If you flatten it out, it goes a little bit longer. But I think it's pretty certain, according to every model we've looked at, that this is going to keep going in an aggressive way for at least another 2 to 3 weeks.
Are you satisfied that the hospitals can handle it at this point?
I've been amazed by our hospitals. They expanded capacity, like I said yesterday, by 50%. They're working together as one unit now, not 26 different hospitals and different associations. You know, we've got very little capacity in Fairfield County. We've got a lot more capacity in the greater Hartford area. That may turn on its head in another month. So that's how we're trying to build capacity every day. Do we have enough? No.
Do you have information on recoveries?
We don't yet. We're looking at ways that we could possibly track that, but this is another thing that would have to be manually tracked. There's no automated reporting from the hospitals about that, and as you know, a lot of people are self-recovering at home, and so there's not kind of instrumentation around that, so we don't have reporting on that now.
And what about nursing homes? I know that other states are reporting their nursing home numbers separately. Is there any information that the state is collecting and that they can give us regarding nursing homes?
Yes. In fact, we are including in our daily release and DPH reporting package some additional nursing home data today that you'll be able to review, but we are reporting that at this point in time, out of the 216 nursing homes that we have in the state of Connecticut, 30 currently have at least one confirmed case of COVID-19, so that's 14% of the total nursing home count in the state. 14% has at least one case. And you'll see some additional charts and graphs in there that we're adding some more data around that now.
Just following up on that, just to our north in Holyoke, there was a facility, the Soldiers Home. They had 11 veterans that died and several staff members that were impacted or affected by COVID. Can you just talk about maybe some of the measures being taken here, whether it be at nursing homes or the VAs here in the state, to make sure that we have some preventative measures in place?
Well, we were one of the first in the country and to say no visitation in the nursing homes, just because of the nature of the contagion, which could be bringing into the nursing home or taking out of the nursing home. Obviously now we are screening the nurses going into the nursing home, and as I said before, we now can quarantine folks that are tested or at least been in contact, either in that nursing home or we're finding other facilities where people can be quarantined separate from the major.
Regarding that, I know that obviously everybody supports the decision not to have family members visit nursing homes. Is there anything you can do? I'm hearing from family members who find it very difficult to get a hold of their loved one virtually or by the phone. Is there anything that you can do as part of your executive authority to make sure that this happens?
I certainly don't know why phone would be interrupted in any way, shape, or form, but I can certainly look into that. We can also look into ways we can maybe set up a FaceTime or other ways that you can at least look your loved one in the face. I think that's a good idea, Christine. We should focus on that.
I apologize if you've already mentioned this previously, but you talk about this is coming to the first of the month here. Mortgages now have a grace period. Anything for renters?
I can tell you one thing about renters is there won't be any evictions. Court is down. So I think, again, renters who are doing their best, affected by COVID, just like somebody with a mortgage, they don't have to be worried about a foreclosure or an eviction. Beyond that, obviously we're working with the cities because the cities need landlords who pay the property tax. But I think I can give people pretty good confidence for the next 90 days they're going to stay in their home and they don't have to worry about that eviction.
One thing, back to the banks and the credit unions, you mentioned 62. What percentage of the banks are doing this, and what percentage of the credit unions are doing this?
Sure. We've subscribed about 40 credit unions in Connecticut already, and I expect more to come on. That represents about 650,000 credit union members in Connecticut, which is just around about 2/3 of the total approximately 1 million members in Connecticut. So it's been a pretty busy past couple of days.
From a banking perspective, as Bruce had indicated, we literally began this yesterday morning at probably about 8 o'clock in the morning. There's about 52 banks that do business in the state of Connecticut. Of those 52 banks since yesterday morning, we have half of those on board. We have 25 on board, and we expect more to essentially be making a decision to essentially join the program in the near future. So we're very happy about that. That was a very quick turnaround on behalf of the industry, especially because they are doing a lot of other things right now, especially meeting the needs of all their customers, once again, whether it be on the mortgage side or whether it be on the commercial side. In talking with a few of our bankers just over these last couple of days, we've got anywhere between 4 and 10% of their commercial customers that have essentially reached out to them already. And as the CARES Act and the payroll protection piece rolls out, we expect that to increase dramatically. But we're gearing up for it, and hopefully can do the best we can for the most number of customers.
Tom, if there's anybody you want me to give a call to, let me know.
Thank you, Governor.
Is there an updated list that has these things? Because I imagine a lot of people are just wondering, is my bank included in this?
We're going to maintain a list on the website of our bank. So if you go there in the next half hour, there will be the most up-to-date list, and that list will get updated on a regular basis, at least twice a day for the next few days, because we expect it to go up.
Josh, could you go into a little bit further about the reporting of the fatals? Yesterday we were reporting there were 64 dead. Today there's 69 dead. Yes? So what happened to the others? How did the 16 turn up over the course of time?
Can you repeat your question? I didn't follow the first part of it.
I'm trying to figure out how you got the discrepancy on the reporting of the fatalities.
Okay, so
Now,
yesterday,
yesterday, I believe we're reporting 64 dead yesterday.
36 yesterday.
36 yesterday. Maybe, well, gee, numbers, there you go. Okay, can you explain what happened to the 16 people you found in the last 24 hours?
So if I understand the question correctly, so 16 people passed away in the last 24 hours as a result of COVID-19 across the state. In addition, we've added to our count today an additional 17 reported deaths that had not been reported to DPH previously, but that we were able to identify that had been reported to the Office of the Chief State Medical Examiner over the course of the last 2 weeks. So there's a catch-up there.
Question for the Governor. We're getting a whole lot of emails about unemployment checks. A lot of people have filed for unemployment, haven't heard back. They haven't received their checks lately. Obviously, there's a whole overload in that department. Can you just talk about the all-hands-on-deck approach you guys are taking, and just kind of a message to people who might be waiting for their next check right now?
Yeah, I can tell you that now we have 100,000 claims. I'm saddened to report that there's a 5-week lag time. I'm heartened to report that everything is retroactive, so even if it's slow for us to get back to you, it's not because our heart's not there, it's because the technology is 40 years old, and we're loading in more folks every day to help catch up with that backlog. We're processing as fast as we can, but the load is going up. But it is retroactive, so you're not going to be foreclosing or losing any money. It will take us a little time to process it. We'll get it done. And hopefully that $1,200 check is, 10 days away from the feds? That'll help as well.
Did your department going to start reporting the numbers, the unemployment numbers?
Yeah, I thought we were already, but if we're not, we will.
We're hearing from essential workers who are still going to work. They might be presumptive positive, but they just can't get that official diagnosis, and without that official diagnosis, they can't get sick time. What's your advice for those people who are still going to work, who might be feeling under the weather?
If you feel like you may have flu-like symptoms, you've got to stay home. That's been our dictate for months now. It's tough because we're running short of bus drivers. We're running short of folks to serve in the grocery store, not to mention frontline workers that are in hospitals and nursing homes. The good news is we had another close to 1,000 volunteers stepping in, saying they'll be able to help in the healthcare crisis. These are nurses and other folks. So we're trying to fill that as best we can. But if somebody's not feeling right, stay home.
Non-essential businesses, Governor Charlie Baker, who you know very well, is extending his order until May 4th. What is the latest on your time frame on these things, as far as extensions go?
I didn't know we had a time frame on it, but look, right now it's for the foreseeable future. Charlie likes May 4th. Let's start with that.
Mr. Governor, on essential services, and I know you're a gun control advocate, the Newtown Alliance and some of the other groups are still asking, more guns make children in the home, and they're stuck there now, less safe. are you going to reconsider allowing gun stores to stay open as quote-unquote essential services?
As I said before, I am making every decision right now based on public health. You're right. I am a strong gun safety person. Right now, my focus is public health. And what I really was worried about were some of those gun stores where I saw pictures of crowds in and out hanging around. That's why we said it's going to be by appointment only. And we've asked public safety. They've patrolled, and I think people are honoring that commitment.
That we didn't do so well with testing on the front end, and we're still playing a little bit of catch up on that. Are you thinking in the future about getting antibody tests to the state so that we can figure out who has had this and who can safely go back to work?
Yeah, my understanding, and Josh can fill in, we're already doing some sampling on that right now in our hospital system and getting the blood plasma in ways that we can check that antidote. And more importantly, we're talking to the company that's the leader in that 15-minute test and what that would mean if we could get access to some of that, what that would mean in terms of those first responders we were just talking about over here who aren't sure whether they have a slight case of the cold or something more. That'll be invaluable to giving them the confidence they know whether to stay at home or they can go to work safely.
Talking about tests, is there an average time, like a turnaround time? Because even last week we were hearing some people were waiting 8 days to get test results.
Yeah, it depends a lot on where the test is being conducted. So we, several of our hospitals now have in-house testing that they've set up for themselves, where they're turning those around very quickly for their inpatients. Yale New Haven, Hartford Healthcare in particular. Our state lab is a little backed up. It's taking a couple days to get through there at this point, but we've got additional staff on and working through that. Where you're hearing about some of the really severe lags, I think, have to do with some of the commercial labs, particularly the labs that are being fed by these drive-through testing centers, which are primarily sending those samples to LabCorp and to Quest, oftentimes out of state. And those commercial testing labs are significantly backed up right now. So we've been working to try to bring online additional testing capacity in-state. So the Jackson Labs announcement last week, I think it was, they're working to increase the volume that they can test in-state, and we're working with another lab that we hope to be able to announce in the coming days.
We know that everybody who gets tested doesn't necessarily have that test run. Do we have any numbers on that, or no? There's a prioritization after you actually get the swab. So your test might not necessarily immediately go into the system to actually be tested.
Yeah. So again, I think it depends a lot on what the third parties are doing, the third party labs. I mean, in terms of like the state lab or the hospitals, the prioritization is all about admitted patients so that the decisions can be made quickly about what type of care they need, what room they need to be in. It has implications on how much PPE is consumed. So that's where the prioritization is happening for the in-state testing.
Health insurance in the state. You mentioned executives were meeting today. You mentioned, sounded like some promise would be coming either tomorrow or this week. Is there any guidance for a lot of these small business owners who have these group plans that maybe we found out that a lot of insurance companies are offering these extended grace periods, but they're not really advertised. You have to call up and they're doing it on a case-by-case basis. A lot of these employees are being terminated and having to terminate their employees. Any guidance or promise you can give?
Well, if they wanted to do it quietly, they can't with you keeping us on our toes on this. But I am very confident that nobody who's got COVID-related distress is going to have their health insurance cut off. I think the health insurers, and frankly all the insurers, property and casualty as well, are stepping up just like the banks have done. And I'll be able to state that with more certainty tomorrow. Thank you for pressing that, because you're the guy that carried that water.
To mention that deposits are safe in federally insured banks and credit unions. Has there been an issue where people are trying to grab large sums of money out of banks locally, and is there some sort of guideline that banks are following right now?
There's been a couple, because people get nervous, but there has not been anything major. It's business as usual. Before this crisis, if you went to a bank, you want to take $100,000 out, good luck. Because they don't keep that kind of reserve in the actual branch. If you order ahead of time, yes, it could be arranged. There is no problem with cash. There's no problem with liquidity. And the Federal Reserve have made sure that the supply of actual cash is available. What we're concerned with is you walk out of a bank with a large sum of money, You could get robbed, you get hurt, you could lose the money. And unless there's a really good reason for that, I mean, we expect people, if you normally take out a couple $100 every week or $50, then you may take out a little bit more because you're doing more groceries or you may want to have a little reserve. But we don't expect that if you normally take out $50, then now you're going to take down $5,000, right? Now, if you want to do that, the money is there. You know, we're not having any issues whatsoever with the money supply.
You have a 90-day grace period. At the end of 90 days, be expected to pay 3 months back at once, or is it kicking the whole loan, kicking the can down the road, or how is it going to work after 90 days?
Every case is going to be a little different, but in general, what we expect is going to happen is it will be added at the tail end. So if you had 200 payments left, and you had 3 months forbearance, now you had 203 payments left.
For Josh, maybe, you gave a time frame on when individuals might be seeing that $1,200 check coming from the federal government. Any information or a time frame on the small business loans? I know a lot of small business owners might be waiting patiently to put that money to work and put it to the street. Any guidance on when that'll be coming?
I don't think we have any guidance to share on that today, but we're working hard on that.
Governor, back to the lag time you mentioned, I think you said 5 weeks lag time on the unemployment. If somebody is trying to apply today, are you also saying that their federal money, the $600 a week, will also be delayed since it's part of that process?
No, the federal, I believe, is a separate process, right, Josh? So that's independent from what we're doing in terms of getting our Connecticut checks out.
So it would not come to you all in one check? The federal and the state put together in one check does not work that way?
That's my understanding.
Federal legislation, some of it will be separate, some of it will be together. And it depends also on who the filer is and what the program is. So it's complex, but as the governor said, despite the challenges we're having processing all the claims, the payments will be retroactive, and so people will get their money.
And Chris, the toughest group are those independent contractors, those gig workers who maybe weren't traditional employees. And the federal act was good. It expanded unemployment compensation to that group. We have to set up that process, and so does 49 other states.
To us, actually, the 69 deaths reported, you said you got 50 ventilators sent to you this morning, was it, that they came in? Were any of those deaths specifically because of a lack of a ventilator present, do you know?
No.
No? Okay.
With that May 4th date, does that apply to schools? Do we expect schools to remain closed through at least May 4th now?
We haven't made any declaration post April 20th, and we'll be hearing from Miguel Cardona, the commissioner, on that very soon. But I've urged them, give parents, give superintendents as much notice as they can, because there's a high likelihood that it's going to go past April 20th.
Hey, Governor, so this morning you were interrupting the endless stream of Aerosmith songs on WPLR. You were talking about people over 60 staying inside. Knowing your age and what you said on the radio today, have you gotten tested yet? How do you feel, and when are you going to get tested?
I feel great. I have not, at this point, been tested. As I told Chaz and AJ, I'm at home probably 80% of the time, but I do feel some obligation to go get out in front of people every chance I can. I've been extraordinarily careful, I think, with social distancing. Test is to be determined.
Two last quick questions here. We keep getting messages about construction sites in the state. What are deemed essential, not essential? Is there a number that you're willing to put on how many people are on a job to make it essential, and if these people who are working should continue coming to work and working in closed spaces?
Right now, as opposed to essential, non-essential, what we said is if you can work safely. Those big outside projects, the Charter Oak Bridge, where you can easily have social distancing, those are the type of projects that we want to keep going. And I said in some cases we're able to do them better now because of the lack of traffic. Those tighter areas where you can't keep social distancing, maybe inside construction work, I just think that's dangerous, and I think that should stop.
Last question. A lot of people in the state might be fearful right now, seeing what's going on, if they have kids at home, if they're elderly, if they're parents, they haven't been able to see them. What's your message to the people of the state right now who might be scared?
That I'm a little scared as well. That this is something that's totally unique in American history. And this month could go a lot of different ways. And the only confidence I can give people is everything that we can control, I think we have the best people in the world working together, arm in arm, to get that done, be it healthcare, be it economic security, what you hear here from the banks going forward. That which I don't control, like the PPE, like the ventilators, is a source of enormous frustration to me. And as I started out, the fact that I'm asking first-line responders to go to war without all the protective gear they deserve is heartbreaking. But we are doing everything we can, and I know this state and this country is going to get out of this stronger. Thank you, everybody.